Morning. Thank you all for joining and just coming with us to talk a little bit and learn some more about PFA contamination in Poestenkill, New York. So I'm Ariana Trapp. I'm the executive director for the Water and Security Correction Coalition. Again, like Annabelle said, I just want to plug again the survey. It's really important for us and for what we're doing, and we think that you guys would really benefit from it as well. But just a little bit about today. Like I said, we're going to be talking about PFA contamination in the town. And my name is Ariana Trapp. And then Annabelle, she's actually going to kick us off, get us started. She is the founder and board president of WICC, as well as the project lead for the Upstate Water Contamination Project, which you will hear tons about as we go forth this morning.
Awesome. Well, thanks, Ari. I'll just start by, for all of you who aren't familiar with us yet, we are a small nonprofit called the Water and Security Correction Coalition, but that's a mouthful, so we like to call it WICC. We're an entirely youth-led 501c3 based here in New York State. And though our base is here in New York, our team is comprised of about a dozen young people from all over the country who want to eradicate water insecurity in the United States. But other than being youth-led, our organization takes a unique approach to solving water insecurity. When I founded WICC, I knew that water security was a super complex issue that couldn't be solved with just one solution. So in the spirit of sort of using all of the tools in our toolbox, WICC utilizes these 5 key action areas that you see on your screen to approach achieving clean water for all. And they are meaningful education, youth empowerment, legislative advocacy, grassroots activism, and fundraising development. And we also approach water through a sort of gradient lens, knowing that water insecurity comes in a number of different forms, all warranting unique solutions. And we view the issues that different communities face through these 3 buckets of water issues. And they are infrastructural and systemic, contamination and pollution, and weather and climate induced. And so for the past few months, my team and I have been building out a community-oriented program called the Upstate Water Contamination Project. I grew up in Greenwich, New York, which is not far from you all in Poestenkill. And after 3 years of building this nonprofit, I knew that I wanted to focus on uplifting communities around my hometown that are facing water insecurity in a variety of terms and forms. So while on the one hand, our UWCP team is working to address road salt contamination in the Adirondacks, which is this fun surveying effort that you see on your screen, we also wanted to uplift Poestenkillians as you all deal with this emerging PFAS problem in your town. And we want to do this through, in broad terms, resident education, improved communication between town residents, your local government, and your state government, and overall improving the water safety of the water systems that you all rely upon every day. So today is the first component of our work in your town. All of you have actually completed a very vital component of this project by taking the pre-event survey at the beginning of this webinar, but if you haven't yet, the link is still in the chat, so you still have a chance to. We plan to use these surveys to really get a collective understanding of where you all are at in terms of how you feel about PFAS, how you feel about your government's efforts in solving this problem, and what we should do next to get you all to a place where you feel safe and secure. So after this webinar today, we'll want to invite you all to an in-person town hall, which we're planning probably for the end of January, if not early February, where you'll have a chance to speak directly with your local leaders and state leaders about this issue, and also have a chance to hear straight from the horse's mouth on PFAS testing updates in your community. WICC is also working toward raising funds to help you all with testing supplies. After talking with the concerned citizens from Clean Drinking Water, who you'll hear from today, we really understand that more widespread testing in your community is a priority for you all. And we want to help you better understand the extent that these forever chemicals are threatening your health. And so before our CCCDW colleagues get a little bit more into detail, I thought we'd start with a broad overview of what's been going on in the last year. So it all started in January 2021, as most of you probably know, when Averill Park School District wells were going through a routine regular water testing that's required by New York State. And although this was a routine initial start, the results for PFAS, or per and polyfluoroalkyl substances, came back super high at Algonquin Middle School. And so the Department of Environmental Conservation directed the school district to collect confirmation samples just to make sure that those really high results really were really high. And so as they were doing this, the school district also shut off their water fountains and asked kids to rely on bottled water instead of drinking out the water fountains. And so over the first year since PFAS were detected at Algonquin Middle, the DEC rolled out a really slow paced testing strategy at properties across the town. And they focused on either areas that might be a potential source. So you might kind of be able to see it on the screen, but like the Poestenkill landfill, some properties around there, the car wash, some properties around there, the Cooper tire disposal area, a couple properties around there. And then also anyone that was just around Algonquin Middle in general were the prioritized properties that were tested. And so by the end of the year, 77 different properties were tested. 17% were above the state maximum contamination level, which is 10 parts per trillion, which, as you'll probably hear us talk a little bit about today, and many more times in the future, 10 parts per trillion is already too high. It should be as close to zero as possible. And so 58% of the other properties tested had at least some level of PFAS. And that indicates that there might be a health risk there. And so most recently, this past November, Governor Hochul's office awarded over $3 million in grant money to establish a new water district around Algonquin Middle. And that will cover 60% of the costs in creating that new water district, but that still means the town needs to find 40% of the funding to pay for the rest of it. So not only should we stress that we need more sources of funding, but we also need more research and attention from local leaders in general. And overall, we can't stress enough that finding the initial source of the PFAS problem is our main priority. As of now, no source has been found to trace back where the PFAS are coming from. Free testing has also been limited to the properties that the state has selected, which means as of now, if any other residents wanted to test their water, it would come out of their own pocket. And this non-uniform testing means that there's a lot of confusion around the problem, like how bad is it? How many of us are drinking contaminated water? And of course, where is it coming from? And so with that, I'd like to turn it to Greg Patnon from the Concerned Citizens for Clean Drinking Water.
Thank you, Annabelle. And we thank WICC for inviting us to be part of this morning's webinar. And good morning, everyone. Let me talk about Concerned Citizens for Clean Drinking Water. We are an ad hoc group of residents formed in October of 2021. And when I say an ad hoc group, we really are just a collection of residents who live near Algonquin Middle School. We are not a formal entity of any kind, but we needed something to call ourselves, and we came up with Concerned Citizens for Clean Drinking Water. Our mission statement includes providing guidance and timely information through our Facebook page, our website, Zoom forums that we have held in lieu of, because of COVID, basically, we had to come up with an alternative method of meeting with people. And we did manage to have an in-person gathering this past summer. If you sign up through our website, we do offer a once a week email for anything we post on the website. So it's not like you have to go checking the website every day. You will get a digest of information that gets posted there. We advocate at all government levels, again, with the and giving people the information that they need to have conversations. Our steering committee, which consists of 15 people, some more active than others. We meet bi-monthly via Zoom. And we also have regular email exchanges when things pop up that need our attention and we want to discuss them. So engagement with government, what have we done? Well, just about a year ago, we met with Governor Hochul's staff and to discuss what was happening here in Poestenkill and asking for her office's assistance in engaging the state entities, certainly under her leadership. And again, when I say met, this is during COVID, so this is via phone call. We met with her office. We had an appearance last April before the Rensselaer County Legislature. We addressed them, asking them to become a little more engaged with what was happening here in Poestenkill. And we've had ongoing dialogues, which we think certainly have been important, with Town Supervisor Keith Hammond. We had met with him as well as his staff, including Town Water Manager Bob Burnett. We have dialogue with state officials at the DEC and DOH, usually asking for updates, status of things. And we have had conversations with the county's environmental health director. Probably not as much as we did earlier on, but we certainly have, we know who to contact. And the state officials, the county health, environmental health director, they have been part of the community forums that we have had on Zoom to discuss latest updates during this issue that we're having here in Poestenkill. Our outreach efforts. We supported the town's effort to secure water, as Annabelle mentioned. We sent letters in support to Majority Leader Schumer and Senator Gillibrand and Congressman Delgado. At the time he was a congressman. We have updated now Lieutenant Governor Delgado on the progress in Poestenkill. Shortly before we formed in last year, then Congressman Delgado met with town officials and residents to discuss the issue. So he is well aware of what was happening in Poestenkill, and we updated him. In his office as far as what was going on here, and he also, again, just to remind him that he was here, and we still have this issue. And I happened to have the opportunity to actually speak to him in person last month, reminding him, thanking him for his concern about Poestenkill, so that relationship continues. We try to have regular attendance at town board meetings, even if we're not there in person. We'll watch the YouTube video of the meeting, and if there's anything water related that we think we need to follow up on, we will reach out to the town and ask them. We've done press releases to local media, and we have done numerous on-camera interviews. So we're available and we're out there. In fact, I did an on-camera interview, and I heard from someone I used to work with said, "Oh, there's Greg complaining about the water in Poestenkill." So I know people are watching. The last three things here I do want to highlight. Notification to residents around the Dynamic Systems Inc. Facility. It's an industrial site here in Poestenkill. It's probably several miles from the middle school. So while we concentrate on the middle school, and that's where most of the discussion happens, this entity did have a reading that was detected above the state MCL. And we were concerned that residents near the site weren't being notified. I mean, we didn't ask all levels of government to suggest, shouldn't these people be notified? It's not to assign blame to anybody, but it's like information that people probably should have. So we ended up taking it upon ourselves to distribute flyers to homes near the DSI site. DEC did subsequently, with DEC and the state agencies and the county did subsequently reach out to some homeowners. I think they reached out to 13, 6 said, yeah, we will have our water tested. And I believe all those water, nobody was above the MCL that they tested. But again, it's, this was us stepping into a role where we think that government fell a little short on, that folks should have been notified. The next bullet, this happened just recently. CCDW signed on to a letter that Environmental Associates of New York sent to to Governor Hochul and the state health commissioner on the proposed new levels that have been proposed to be set by Department of Health. In general, we think that they're not as aggressive as they should be, certainly compared to neighboring states. They're setting levels for 23 additional PFAS chemicals. And like, again, New York, we think New York should be a leader, with the Empire State. We should be leading here, and we think there's more opportunity to do that with more aggressive standards. So we certainly hope that the state will take those comments into heart and propose something a little more aggressive, especially notification. I mean, it's the state's, actually it was the state's leadership that we know why Algonquin, that Algonquin tested above the level. And as homeowners, we would have had no clue that this was an issue here, but for the state requiring schools to be tested. This is another area, again, it's not to assign blame, it's to give homeowners the information they need to make an informed decision as to whether they want to get their water tested, whether they want to put in a home filtration system, whether they choose to do a risk management analysis and just decide I can live with this, but give the people the information they need. And the last thing we have done is we've shared the school test results. Susan will be getting into that in just a moment. So this is the latest update that we have. The filtration, as many of you may know, the filtration system at Algonquin Middle School is now online. It went online the Monday after Thanksgiving weekend. Again, this was a long process because they have to flush out the system to get the contaminant out of the water. And you can't just flush that into the ground. You have to have a truck and take that water and bring it somewhere. But they finally got to the point where it was working. It was turned online. So that's a good thing for the students and the faculty and the staff at Algonquin Middle School. The state and county officials retested 11 private wells that were below the MCL of 10, but above 5. And it turned out the retest that they did, the results were consistent. In other words, there really wasn't any change in homeowners' levels, which sort of disappointing. You would have hoped that possibly these levels would have gone down, but according to the state data, they haven't. DEC this past summer has done a variety of tests around the middle school. I mean, you can see it on the slide. That's a very high level summary of what they've done. It's obviously there's a lot of technical things, but they drill test rolls. They're varying depths so they can check water flows, which way water may be flowing, is any contaminant. Both groundwater and surface water were sampled. Again, if you're not familiar, groundwater is what's in the ground. That's where you get your well water from. Surface water is like a lake or a creek that is just sitting there. And they've also been looking at the former and current industrial sites. Annabelle mentioned that in her introduction. Now, they did find a level that exceeded the state limit at a tank at the transfer station. It's a containment vessel. So at least to me, who's certainly not a geologist or an expert, you would expect a high level in a containment vessel because it's probably filled with horrible things. The key is whether this leaked out. The report is that nothing leaked out of the tank, but that's one of the things I believe that DEC is looking at. So the data is being analyzed. We're hoping for a report this fall by state officials. DEC has put out periodic updates. I believe the last one I think they put out to the general public was in May. I mean, we've been fortunate that they through our dialogue and a relationship, they do give us periodic updates. I was informed yesterday that the next update is scheduled for January, and hopefully that actually might work out well for WICC's proposed town hall meeting at that time that Annabelle had mentioned. So those things could be a confluence because DEC and the county have said that they would have an availability session once they finish analyzing the data and have some conclusions. So looking forward, where do we see this going? Again, we have a commitment to find the sources of the PFAS in Poestenkill. We've always kind of said we're not going away until we get an answer. It may be one source, it may be multiple sources, but we're looking for the government officials to come up with a scientific conclusion that says this is what it is to the best of their ability. This this is what we think has caused this. And I think it's important because, again, one of the things that's been missing here is a time frame. We don't know how long this has been around. I've had 2 children going through, they're both through Algonquin Middle School. Many others have as well. There's been staff and faculty and staff that have worked there for 10, 20, 30 years. How long has this been there? Will the information that DEC gives us and the Department of Health gives us give some, provide that information to people? Will it explain, will it detail unexplained health issues that people may be having? These are still unknowns. The other important issue about finding a source is that it opens up the door for Superfund money. You can't get Superfund money unless there's a source. Superfund money would help pay for reparations, the water district possibly. So it's important that that continues to be addressed. Certainly transparency on testing results. We have asked for this for a while. The county had been providing updates to its Facebook page. Those stopped probably last March or April when the aggressive testing ended. We were mapping stuff and we were providing maps to people as best we could. And we basically had to stop doing that because we just do not know the residential testing, if any, that has continued to go on. And we advocate for free town water testing. Some people in this town can afford to have the test. We pay for our own test, but there's others that probably can't. And a financial barrier shouldn't prevent someone from being able to find out if their water is contaminated or not. So that's an area that we still feel passionate about. And I believe that's it. And I'm now, thank you for listening. And I'm going to pass along to another CCCDW member, Susan Gibbons. Susan, over to you.
Great, thank you, Greg. Just from an introduction perspective, I, like Greg, have had 2 children go through the school. I've been living in the district and as well as the town for 28 years. And as part of CCCDW, I kind of made my little niche to be following what's going on at the school, even though my kids are grown up and out of there. I felt it important that we keep on top of those, and as part of our education arm of our organization, to share results, because the results are kind of tedious to go through. I'm like go cross-eyed trying to review them. So I thought, I will summarize lots of data. And it's not all of the data. And if anybody would like to see my spreadsheet isn't even all the data. But you can see I have quite a bit of detail in there. So if you'd like to reach out to me to get information, I can provide you with that. Otherwise, everything that I present here from a data perspective is found on the Averill Park School Systems website. And it's under District Information PFOA. And, excuse me. And I've also had numerous conversations with Aaron Hefner, and he's the superintendent of buildings and grounds. So it's really based on that. And he has been really a wonderful resource, very, very responsive and cooperative in getting and answering any questions that I have. I will note, though, that he relies greatly on the guidance and information provided by the county. So when the county says you can go live with the water, they'll go live with the water. When the county says you should test the school on this, this quarter, he goes forward and follows that guidance. So remember, we started the testing, as I think Annabelle and both Greg mentioned, in January 2021. So now we're going to share some results, and I think some pretty big wows, like breaking news kind of thing that you'd see on the news. So So from a test result perspective, we had some schools that consistently test with no detectable levels of PFOAs, which is great, PFAS chemicals, not just PFOAs, non-detect. So Averill Park High School consistently non-detect for all tested chemicals. So they don't always test, a full, it's not every possible chemical. They do particular protocols, And in talking with Aaron, they are testing more chemicals and picking like larger panels each time, which is good also. But consistently, Averill Park High School, consistently has like non-detect levels, and they are up to date on their annual testing because everybody has to test annually, and their last test was in March. The next school is West Sand Lake Elementary School. Same thing, consistently non-detect for all chemicals, and they are up to date on their annual testing. They had their last test in June. And we're going to move down to the next school, which is Miller Hill Elementary School. So I want to draw your attention to the top right initially. So well 1, once again, consistently low. So they weren't non-detect on all the chemicals, but low or non-detect for all of the tested chemicals. And they are up to date on their annual test. They had their last annual test in July. But I wanted to talk about well 2. So once again, that was tested in July, but then I believe the numbers are going in the wrong direction. And you can see that by looking at the chart on the right. So these are all the dates that well 2 was tested. So this is just well 2 results. And you can see that, PFOS is, quite a bit higher than I would like to see it. And it's been and it's been increasing, up until July 12th, where it had a 7.1. And now to me, it's approaching the 10 parts per trillion MCL. Also, you can see that there is some PFOA contamination as well that is increasing. The one thing that I have is the last bullet is the testing is done before the water softeners. That means that when, the water comes out of the well, they consider it raw and they test that raw water. Then that water, that they've tested, right? Then it'll go through a water softener and then traverse through the entire, Miller Hill environment. So keep in mind, and I put that little asterisk there, that the testing of the water at Miller Hill, where they got a 7.1, was raw well water coming out of the well, had not been through the water softener yet. Okay, if we can go to the next slide. So now let's talk about the middle school. As everybody's mentioned, Algonquin Middle School exceeded the MCL for PFOA, but they were close to the MCL for PFOS on their initial test as well as all subsequent tests. Their highest PFOS number was 9.6. So they were just 0.4 away from, exceeding, or 0.5 away from exceeding the MCL. As was mentioned earlier, until the filtration system rolled out on November 28th, bottled water was used at the school. So why did it take so long to get the filtration system implemented? So before they rolled out, the filtration system, they tested numerous locations within the school. So not just that raw well water that we talked about for Miller Hill, but they tested sinks and concession stands, and there's a lot of different locations that they tested. So you would think, right, after it's gone through this new elaborate filtration system, right, that we would have these like stellar test results. Well, they found out that right after the softeners, they had higher readings than they did on the raw water. The PFOS at the after the softener was 13 parts per trillion, and PFOA was 22. The highest PFOA they got on the raw water was 13. So it was almost double what they got on the raw water. So it's like the water's coming out of the ground and then going through the water softener and getting further contaminated. So keep in mind that the water's filtered first, then the softener, then the rest of the school. So let's go on to the next slide. So this is kind of the aha moment that I had. So what did they do? Well, they can't activate the whole refiltration system with the school because they have higher results than they did with the raw water. So they kind of narrowed in on the softeners. So they replaced the old softener resin, they cleaned the holding tanks, and they flushed the system. Then they retested. And they also sent the old resin out to be tested. So once again, they take a whole battery of tests of all these locations throughout the school, And sure enough, another sink comes back with elevated readings on the retest. So the PFOS was 4.1, PFOA was 3.3. So they're like, my gosh, what's causing this? Well, they found that that particular sink had an under the sink filter. So they removed the filter, they replumb it, they retest, and now they're waiting for results. See if I can get the next little bullet there. So overall, one of the other findings that I had found was even after the filtration, the chemicals were still at detectable levels. So for example, there was a detection of 7.2 for this thing called 6,2 FTSA, and 3.1 for these other two chemicals. And I had this impression that when you put in that kind of filtration system, that this school was going to look just like, the high school and West Sand Lake Elementary, where the numbers were going to be in the non-detect range. But, it's not like a cure-all. It doesn't take it down, that much, to that degree. So I just wanted to point that was a kind of an aha moment that I had, because I expected to look at all those reports and see non-detects for everything, because it had gone through the granulated activated carbon filtering. So good thing to remember for your personal self, as well as, for the school. Okay, let's flip to the next slide. So here's kind of like the breaking news, right? So they tested the old resin, right? And from an old resin perspective, here are the numbers that had, detection. So PFOA is kind of in the middle on the left, right? 120 parts per trillion in the old resin. PFOS, like non-detect, which I can't explain that. I also wanted to point out that 8.2 FTSA, 3,400. You have other things in the hundreds. So I think what I've kind of gleaned from this is, what does that mean for all of us who have tested raw water and have water softeners in our house? What does that mean for Miller Hill Elementary School, where they're testing the raw water and this stuff is going through the softeners? I mean, look at the results for the middle school. Their number almost doubled in an unacceptable range. And because Miller Hill's already at a 7.1 in the raw water, what does that look like after the softener? Okay, let's flip to the next slide. So I just wanted to kind of summarize up with what I believe are the key observations. So overall, the test results remained relatively consistent. Chemicals that tested high, consistently test over test. Chemicals that tested low continued to test low, test over test. So kind of like what Greg mentioned, when they retested people that were in that 5 to 10 range, they came back with similar results. I see the same thing in the school test results, and they tested, frequently. So, so I noticed that same thing. So it's not like, oh, things are just suddenly going away, and it's not like things are suddenly appearing. It seems to be consistent for the same chemicals, test over test. The other point that I think I made earlier is, even after the new filtration system was installed, all tested chemicals did not come back as non-detect, which I would have hoped that, filtration systems would do that for us and get us to, those better standards. Okay, next. Miller Hill numbers keep creeping up, right? Their lowest was, where do I have it? I'm trying to look on my notes here. I think their lowest was like a 4.6 and their highest was a 7.1. So they're going in the wrong direction. I have concern that the testing is, happening after the water softener. Before the water softener and not after it. And what would those results be? And, should we all be testing after the softener? Should we be testing our faucets, right? Like, that's what we're drinking. How do these get impacted by these numbers? And one last thing, I just wanted to reiterate that I am not from the school district. This information all came from the district website, as well as conversations with Aaron Hefner. And I think that's it.
Does anyone have any questions for either Annabelle, Greg, or Susan? We just wanted to take a pause here. We know there was a lot of information. So if you have any questions about stuff happening in Poestenkill in general, in the school, any questions about CCCW or even WICC, we'll be happy to answer those now.
Yeah, I have a question for Greg. You mentioned that they're going to be trying to identify the source of the PFOA. Do they have a timeline on that? And I had heard that they had already, I don't know, 15, 20 years ago, drilled wells at Dynamic Systems Incorporated, I think because they were a Superfund site. And have they tested that? You know, I initially did not think Dynamic Systems was close enough, but then if I look at the water map, it actually seems like it drains in that direction. And so I wonder what type of testing they've done at Dynamic Systems since DEC already had drilled a monitoring well, you know, many years ago.
I mean, this is what at least we know, because I went back and looked at my notes today. I don't think we've gotten an update on DSI since May or June. They were supposedly, that was going to be incorporated into the next update, and we don't have that. But there was supposed to be more sampling of the well that was detected, because it was in one of the wells that was on site. And it's part, you know, because their DSI is part of you know, another ongoing investigation, because you know, they've been monitoring it, but we don't have we haven't gotten that update, so it's still something that is one where we have to remind DEC, you know, we were expecting an update. We don't have it on DSI. And it's back to where everybody's talking about the middle school. You kind of forget about DSI.
And do they have a timeline for the rest of the, you know, identifying the sources? And have they backed off their claim that Sean Mahar was making, that he thought it was the floor wax being used at the school by the janitors was the source of the contamination?
I haven't heard them mention floor wax in a while, but I'm getting the feeling, and this is just me, is that it's going to end up, is that they're thinking that it's multiple, might be a combination of things. Individual sites, like the former tire dump, contributing to the level, or whatever was at the middle school before it was built in the mid-60s. It may have been something there, which, you know, I hope that's not the case, because that's really bad as far as that timeline I was talking about, people working and going to school there. I don't know. I mean, they haven't tipped their hand as far as where this data is going to lead as far as a scientific conclusion. Outside of, you know, little indications that it may be coming from, you know, small sources and not one big source, you know, but that's where we, you know, continue to, you know, have dialogue with them, saying we're not, you know, we're not going away until we get an answer.
Hey, Greg, and I just wanted to let you know, I looked up what DSI did test for. And the one well that tested high came back with 23.1
Right.
Parts per trillion.
Yeah. Again, it's another one of those, what I will call annoying levels. It's, you know, it's not like Hoosick Falls where it's 3 digits, but it's above the limit, and, you know, and it's not going, you know, it's a forever chemical. It's not disappearing unless you do something with it. And that actually gets to another point that I forgot to mention, and I guess I'll add it now. You know, again, we think it's great that the town is pursuing the water district, and we certainly hope it will get more funding than it's got, than it's received. You know, maybe it's not going to get 100% funding. Those things rarely happen, but certainly more than the 60, at least enough that town residents can vote in this area, because it would only be the people in the water district near the middle school that would vote on it. whether they want to pay for it or not. But I think there's a tendency of some people to think, okay, we put in the water district, everybody has that water available, and we're done. And to me, I equate that to going to the dentist with a cavity, having the dentist fill it, and you never drill out the decay. It's still there, and eventually that filling's going to fall out. So, one thing is nice, but it doesn't negate the need for finding out a conclusion about what the source is. That still has to be pursued.
Thank you.
Thanks, Greg. We also have a question in the chat. Do you know whether studies have been done anywhere regarding the impact of water softeners on PFAS? And she mentioned that that data is scary, which I agree.
This is Susan. I did bring up the whole water softener topic, and I do not know if there has been anything, but I, have, call up the state every now and then. And I did have a whole laundry list of things for Keith Hammond to ask of the state and county related to DSI specifically. And I would like to, start that conversation and say, hey, where are my responses to this? Because I sent the email out and then went away for like 5 weeks. And now I'm back. So I'd like to get those DSI answers, and I'd be more than happy to share those with you. As well as I want to bring up to the state, what's up with water softeners or even filters. If your filter gets dirty, is there a point where it's now not going to even do the job, but it's going to now put things in from the stuff that's already been captured there? I don't know that, but that's on my to-do list to talk to the county and state about. And just to get their feelings about why aren't we testing at the faucet, especially at schools? Right? Because that's where they're drinking. So the answer is, I don't know, but I'm I've got it on my to-do list to kind of start the dialogue.
Okay, thank you, Susan. Any more questions before we move on? All right, I believe that next we have Nico. Yes.
Awesome. Hi, everyone. My name is, can you all hear me? Okay, cool. All right. So my name is Nico, and I am the WICC Director of Advocacy. I am currently a junior at Loyola Marymount University. I'm originally from Cape Cod, Massachusetts. I went to school in Albany for a year, so pretty familiar with the area, but I now am living in Los Angeles. Okay, so I'm going to talk a little bit about kind of the health impacts of PFAS and why they are specifically harmful to us as humans. So, regarding the chemical composition of PFAS, they are really, really tough to break down. They don't break down, especially in water. And this toxicity and persistence of them poses a really strong danger to public health. So the CDC has recognized that exposure to high levels of PFAS may impact your immune system due to high evidence that PFOA and PFOs suppressed your antibody response from animals and a moderate level of evidence in human studies. So a lot of PFAS studies have been done currently on animals, and they're trying to translate that over to humans, but because they are so toxic to humans, it's a little difficult to study their exact effects on us. Awesome. So a little bit on kind of why they exactly are harmful to us and what they cause in humans. So a lot of recent human research has suggested that high levels of certain PFAS have led to high cholesterol levels, changes in liver enzymes. It has caused small decreases in infant birth weights. It has decreased vaccine response in children. They have led to increased risk of high blood pressure in pregnant women, an increased risk of kidney or testicular cancer, And at this time, scientists are still adding health effects of exposures onto this list. So this list is constantly expanding, and many of these symptoms of PFAS contamination in our blood are relatively new. So these are even just a small category of what is seen due to having PFAS in your body. So a little bit of like exactly how you can get exposed. I know we talked about this a little bit, but you can be exposed to PFAS in a variety of different ways. So yeah, so a major way is through drinking contaminated water, eating fish that was caught in contaminated water, swallowing contaminated soil or dust, eating food that was raised near places that manufacture or use PFAS, eating food that is packaged in material containing PFAS like plastic, and using consumer products that contain the chemicals. And to be honest, the PFAS are in a ton of different things that we use every day. They're used in nonstick cookware, pesticides, herbicides, firefighting foams, fast food packaging, personal care products. They're in a ton of stuff. So even if we think we're not really being exposed to PFAS, it's important to also consider that things you have in your home might even have some of the chemical in it. So originally our goal was to have a close partner of ours, Manny Baringi, who is a physician and public health expert, present this health part of the presentation, but unfortunately she is at a different conference today in Chicago, so she was unable to make it. So I kind of presented the health stuff on her behalf, but she did send us a statement, which I'm going to read, and I will link it in the chat for anyone that wants to follow along. So I'm just gonna start now. She says, "Hello, my name is Manny Baringi. I'm a board-certified occupational and environmental medicine physician and clinical associate professor of medicine at the University of California, Irvine. I practice not only in California, but also in New York. I have a personal connection to New York. I had the great fortune to spend a portion of my childhood in upstate New York. I spent my elementary school years in Niskayuna. I remember the winter time in the magical snow where we made snowmen and snow angels in our backyard and skied at Lake Placid. I remember the summers that were never ending with sunlight and the fun we would have at Lake George and Lake Luzerne. Our family would later move to California, but I never forgot my time in upstate New York. Over the past decade, I've continued my work in environmental health to better understand the long-term population health impacts of prolonged chemical exposures. One group of chemicals challenges me. That is PFAS. There are tens of thousands of PFAS compounds that are present in our water, in our soil, in our clothing, in our kitchens, and in us. I've done research on PFAS and its effects on the human organ systems. I've reviewed the up-to-date scientific articles in the latest clinical guidance, but nothing would have prepared me for what I have seen amongst patients I have access who resided in Hoosick Falls and surrounding towns. Many of these residents, dependent on well water, had over the course of years begun experiencing fatigue, weakness. They lacked energy to do usual activities around the house. With subsequent workup, it was found that they had underlying metabolic disease like thyroid conditions. Only with recent state monitoring of well water, it has been identified that there were high concentrations of PFOA, a PFAS chemical, and further testing of these patients revealed that their blood levels of PFOA were tens to hundreds of times above the norm. With remediation and subsequent treatment of the metabolic disorder, were these individuals then able to resume their normal lives. Being able to help with these upstate New York residents to further educate communities about PFAS, to inform parents, school teachers, business leaders, emergency responders about PFAS, to raise awareness of the long-term health consequences of PFAS exposures to my medical and nursing colleagues, and the available medical monitoring tools available. These are activities I take great pride in. Know that I am in this work for the long haul. Manny Baringi. So yeah, so that was a really awesome statement that she left for us, kind of talking about her experience working with PFAS and Hoosick Falls. And I think something that we really wanted to hone in on was the health impacts that are a result of high level of PFAS in our blood, because really these are in our water, but they're also in turn can be affecting a ton of people's health. And the fact that these were in the middle school water, and children have been drinking the water for who knows how long. It's important just to consider the long-term health impacts of all of the people who are drinking the contaminated water. And so in response to kind of the health impacts and whatnot, we have created a PFAS information flyer specific to upstate New York in Poestenkill, which talks a little bit more about the health impacts, your exposures, and goes into a little bit more on like the New York State contamination, the Poestenkill assessment area in the middle school. And there's also a Spanish translation available. So I'm going to link the link to the flyer in the chat, and anyone who wants to access that is more than welcome to. And I think it is going to go back to Greg. I think you're muted, Greg.
There it is. I'm unmuted. So what's next? We will continue. Well, first of all, let me say again, thank you for WICC for inviting us to be part of this. This was a great event, and I think you've recorded it, so certainly we'll be posting it to our Facebook group and our website, so people that couldn't watch live can watch the recording. What's next is the update that we expect to get from the state. We've been waiting for that, and that is that's actually going to be critical, because I think we're coming to the end of this investigation. At least that's my sense with where they view things. So that's important. Certainly trying to pursue the water district in this town and getting funding for that to at least make it go to a vote. That's important. And if you're interested, again, join, you can follow us on Facebook, go to the website. At some point, we'll probably have another in-person forum, but that'll probably be well after what WICC proposes to do. So that's going to come first. And I think that's, at least I think that's all the notes that I had written down as far as what will be happening. If we obviously any breaking information, we will share that with people. And thanks everybody for watching today.
Yeah, so again, I'm Ariana Traff. I introduced myself earlier, but for those of you that joined after, I'm the executive director at WICC. I've been with the organization for over 2 years now, but recently became executive director in July. So I just wanted to thank you all for coming again and for being a part of our Upstate Water Contamination Project. So what's next for our Poestenkill component is, like we've talked about a couple times, is that town hall that we plan to host in January, which will hopefully be kind of a hybrid situation. So we'll be available both online and in person in Poestenkill. And that will be either in late January or early February, depending on our survey results and how we can get things set up. So yeah, and thank you all for completing that pre-survey. So now with a pre, there's always a post. So we now have the post survey. if you guys would scan that as well. I think Nico can also put the link to this post survey in the chat, and you guys just fill that out. Some of the questions will be the same, fair warning, but a lot of the questions are not the same. So we just want to get you guys to fill that out, and it'll be very vital to our Upstate Water Contamination Project. We also want to take this time to answer any final questions that you guys might have. We have a little bit of time if anyone wants to ask a question, and we'll do our best to answer them. But we'll keep the slide up for the post survey while we're answering questions.
Also, this one's shorter, so no
It is
excuse.
shorter. If the first one felt daunting and long, this one is short. Although both of them are relatively short, I think. Thanks, Nico. And thanks, Nico, for putting all those links in the chat. You're great. If anyone wants any information that we have provided to y'all through this webinar, either one of the links or just some of the, like maybe the test results that Susan was talking about, or even just the information, you can email us at, Nico, can you put the email address? But it's yeswic@gmail.com is our general organizational email, and someone will get back to you. Nico also put the link to our project, the Upstate Water Contamination Project. You could just go on the WICC website and look up everything about us too. Feel free to scour through. We are a nonprofit organization, so this is the kind of stuff that we love doing. This is the kind of information that we try to get out to the public. So yeah. Again, any questions? We don't want you guys to have burning questions at the end of this, but if you do, again, we will answer them through email as best we can. And if you want to come to the town hall in January, you can
Ariana?
Yes. Hi.
Burnett, I'm the water manager in Poestenkill. I think, first of all, I want to thank everybody for their work this morning. There were a few notes I made as we went through this presentation, and I'd like to comment on those.
Mhm.
One, today we only regulated on PFOA and OS. Two of 9,000 PFAS compounds. In addition to that, there are going to be additional PFAS compounds that are going to have to be measured during 2023. The minimum number I'm hearing is 23. So what's going to happen then? I am concerned that some people are saying, well, geez, let's take a little school. We've got 2 wells that are fixed now. We're okay if we move away from it. I don't see that as the situation at all. I want to compliment Susan on her data. I've seen some of that before. And I think some of these other schools are going to be a problem in 23. We have water district number 2 proposed, but that really is only going to handle a very small population and a focused, targeted population. I happen to, and I've been involved in this, actually I've been involved in the subject going back to who's at fault. I believe strongly that we have multiple sources, and we've been, all of the testing, although well-intentioned, has not come up with any single answer yet. Now today, our limb MCL is down to 10, but there are efforts underway to take that further than 10. And that's why throughout the last year and a half, we've concentrated not only on readings of individual wells over 10, but higher than 5, and frankly, even less than 5. We don't have, to my knowledge, other than the schools and that kind of a business or enterprise, we don't have any state or federal regulations on individual wells. So we're talking about a handful. Let's take Poestenkill, for example. I'm going to take a guess and say we probably have 1,000, 2,000 wells out there. And we've only focused on a handful of those. So what is being done about the rest of them? Frankly, unless those people come and say, geez, we're going to test ourselves and then put some sort of filtration in, there's nothing that I know of. The efforts of Greg and people on his committee and others, I think are great. Greg said earlier, it seems to me that there's been a slowness in people really getting upset over this in the last year. I can tell you this, at every town board meeting, I'm at every single one of them, make a presentation on this so that our town board members and are fully aware of this and supportive of it. But the answers that we're getting, we'll say the answer, we're not getting answers. There's no one source that's been cited yet. And frankly, not even 2 or 3 sources yet. I happen to personally believe that the multiple sources because of practices that were practiced over the last 50 years. But until we start getting some answers, we're not going to really improve our situation, in my personal opinion. Does anybody have any question that I might be able to answer?
Yeah, I think that kind of what you brought up about the fact that this is only covering 2 of the PFAS is really important, considering that there is over 9,000 of them available, and a lot of them we haven't even developed strategies for testing yet. So there is just like continuous research on more PFAS, different testing, different effects on your health, different exposure methods, etc. So this is constantly developing research, and I think that was a really important point you made. And thank you for making that point. And I think, yeah, if anyone else wants to add anything.
Yeah, no, sir, I didn't catch your name. You said you were the Poestenkill water manager, but do you mind saying your name again, just so we all know it?
Bob Brunette, Brunt. Let me comment a little further. This is, perhaps you all know this, but this is information. From a municipal water perspective, we have had in the past absolutely no control or responsibility over resident wells. That was always maintained by the county and the state. They've done a good job of it. But when I've been involved with the school on the first conference call on when they had 12 and 13 as their levels. You said, Annabelle, earlier in the discussion, they were super high levels. Now, let me be candid from my own observations. Frankly, there are too many people today that say, oh, that's relatively low level. Because Hoosick Falls was many thousands, and then you had Petersburg, thousands, and they say, well, geez, 12. And, it used to be a level of 70. Now we're down to 10. It's just a little, well, I don't buy into that philosophy. I think any level, any level of PFAS is a health problem. The fact that we don't know the impact of the health problem today should not stop us from trying to find out or taking corrective actions. Now, just to reinforce anybody on this conference call, the town board was so concerned. My responsibility prior to this has been code enforcement for a number of years, and then there's the water manager with the existing water district. The town board was so concerned about the PFA issue right at the start that they asked me to take on the extra responsibility of public health coordinator, and that's I think it's a very important function. So the bottom line on that, town board is involved, but we're dependent upon the county and the state, Department of Health, DECs, organizations to keep us updated. And as Greg said, the last updates we've had are months and months ago. Well, I get calls into my office every single day from a resident saying, what's the latest? What's the latest? Well, they're not satisfied with it. I tell them the latest we have is from last May.
Well, thanks, Bob. Yeah, and just to like underline that first comment you made, that's been something we've been saying for a while. Like 10 parts per trillion is way too high. Any amount of PFAS is dangerous. The EPA actually released a statement this past July, based on the latest science. And again, it's an emerging contaminant, so we find out something new basically every week. But when they released that statement, they said that as close to zero as possible, in terms of MCL, is what every state should be doing, because any amount of PFAS is considered dangerous at this point. And the more we learn, the more dangerous we learn that they are. So yeah, just underlining Bob's point there. Thanks for bringing that up.
Additionally, for information, just this week, the EPA put out new recommendations for groundwater PFAS. Now, that really hasn't been done before, and it's only a recommendation at this point. But I think the conclusion should be that, now what does that have to do with wells? Everything I've read and been told is that there are so many different possible causes of the various PFAS compounds that can come from your septic tanks and on and on and on. This is just another area that's going to affect, in our case, what they call SWIPs, stormwater pollution prevention plans, and other such plans. And people have never been involved in this before. They have to become knowledgeable of it now, in my opinion.
Thank you, Bob.
Annabelle, I just want to certainly thank Bob for joining, because we did send out the note to many of the government officials, and Bob's the one who's here, and appreciate it. And also, people should know Bob has been very instrumental for people that have wanted to do their own tests. He has shepherded those tests, showing you exactly what to do. You drop off your sample to Bob, and Bob runs it down to the lab. So he's really been a partner in this effort to find out and test people's wells. So I just wanted to throw that out there.
Thank you. Yeah, and thank you for all you do, Bob. I had no idea that that's something that you were doing. That's great. Any other questions from any other members in the audience before we log off? Great. Well, thank you again for everyone for hopping on. Like Greg mentioned earlier, this will be recorded, or it has been recorded, and it will be posted. So if there's anything you want to go back with, or if you have a friend that couldn't make it today because it is a Saturday morning, and you want to send this to them, it will be readily available by the end of the day today. And if you ever have any questions for WICC or CCCDW or anyone else on this call, we can definitely put you in touch. So keep in touch with WICC. Ideally, we see you all at the town hall in January. And yeah, that's it. Thank you all for coming. Stay warm.
All right. Thank you, Annabelle. Thank you, Nico. Thank you,
Bye,
everybody.
everyone. Thank you so much.
So long.
Thanks, everyone.